Okay, so hello and welcome to our 10 of Healthcare Solutions webinar. Today we're presenting What to Expect When You're Attesting, a survival guide to meaningful use attestation. My name is Chelsea Grover and I'm the Marketing Communications Coordinator for ITenace. I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention that the webinar will be recorded. Next, for those of you who aren't familiar with us, I want to share a bit of who we are with you. We specialize specifically in next-gen healthcare. Our goal in life is to make delighted clients by helping them get the absolute most out of their next-gen software investment. We're passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything next-gen, and we have two next-gen add-on productivity solutions, ChartGuard and Refund Manager. So next, I'm excited to bring your attention to an upcoming webinar that we're going to be offering on March 15th. Today's electronic data interchange, so much more than claims. In this webinar, we're going to explore today's EDI capabilities, including appointment reminders, statements, collections, patient satisfaction surveys, real-time scheduling, patient outreach, population health integration, and so much more. You can register for this on our website now or wait until we send out the email invitation. Okay, so back to today's webinar. We're going to do questions at the end, but you can type in your questions in the webinar control panel whenever they occur to you, and we'll go through them in the order that we receive them. So without further delay, our presenters for today are Lindsay Lanning, who's our Healthcare Compliance Consultant at ITenace, and Cindy Kincaid, who's Vice President of Consulting Services at ITenace. So Lindsay, I'm going to go ahead and pass it off to you. Feel free to get started when you're ready.
Great. Thank you, Chelsea. Hi, everyone, and thank you again for joining us today for our webinar, What to Expect When You're Attesting, a Survival Guide to Meaningful Use Attestation. Well, it's officially that time of year again, Meaningful Use Attestation time. So the EHR Incentive Programs Attestation System is actually open from now until February 28th. Providers must attest by the attestation deadline to avoid a 2018 payment adjustment. So in preparation for the attestation process, we will provide you with detailed instructions on how to attest and what you can expect while you're attesting. Our hope here today is to make this process more transparent and provide all of you with the knowledge and tools you need to successfully attest and maintain meaningful use compliance, and most importantly, avoid those harsh penalties. So in today's webinar, we will start by making some important announcements on what you need to know for 2016 reporting, covering deadlines, changes for this year, and alternate exclusions. We will then jump right into the attestation process, showing you how to log in and register to attest on behalf of a provider, since that's what the majority of you on the call will be doing this year. We will then look at each meaningful use objective, identifying what information needs to be entered. We will also look at the CQM attestation process for those of you reporting through the MU portal. And finally, we will look at all of the possible data submission results providers may see, including a rejected attestation, and then wrap it up with our attestation recommendations. So let's get started with important 2016 reporting deadlines. For meaningful use reporting, the attestation system will be open from January 3rd to February 28th, and providers must attest by that deadline, February 28th, to avoid a 2018 payment adjustment. For PQRS EHR reporting, otherwise known as aligned reporting, if you're a next-gen user, the deadline for clients to have their QRDA file approved is actually February 24th. If you're on a different system, you may have a similar deadline prior to the CMS deadline of February 28th. And lastly, for PQRS qualified registry reporting, if you're a next-gen user, the deadline for clients to have their XML file approved is March 10th. Similarly, if you're on a different system, you may want to check for a deadline prior to the CMS deadline of March 31st. So yes, I know this is a meaningful use webinar, but it is all part of the quality reporting, and all three of these programs are wrapped into one under MACRA this year. And I know a lot of people didn't realize NextGen and other vendors have deadlines prior to the CMS deadline. So back to meaningful use. In addition to deadlines, it's important you understand that providers are required to attest to a single set of objectives and measures. For EPs, there are 10. In 2016, all providers must attest to objectives and measures using EHR technology certified to the 2014 criteria. For all participants, the EHR reporting period will be a minimum of any continuous 90-day period between January 1st, 2016 and December 31st, 2016. And for all EPs that chose to report CQMs by attestation in 2016, the reporting period will also be 90 days. Another important thing to know are the changes for this year. So changes to 2 meaningful use objectives will take effect this year, and they are secure electronic messaging, and this affects EPs only. This objective has had a phased-in approach for its measure threshold. Last year, the measure only required that the capability to send messages was enabled. However, for 2016, an EP must now actually send a secure message using their cert to at least one patient the EP sees during the reporting period. This can also be in response to a secure message that the patient sent to the provider during the reporting period. And then just a reminder, since there was so much confusion surrounding this measure last year, for public health reporting in 2016, all EPs must meet 2 measures. Also for 2016, we want to recognize that many of the alternate exclusions that were available last year are not this year. The only 2 available are for CPOE, if an EP was scheduled to be in stage 1 in 2016. They may claim an exclusion for measure 2 and 3 lab and radiology orders. And then objective 10, public health reporting. EPs may claim an alternate exclusion for measure 2, syndromic surveillance, and measure 3, specialized registry reporting, if circumstances allow it. Keep in mind an alternate exclusion may only be claimed for 2 measures and they don't count towards your total. So those are all the updates for the Meaningful Use program for 2016. And before we get started looking at the attestation process, I want to point out that what we will be looking at is the Medicare Meaningful Use attestation process. Medicaid reporting is separate and depends on your state's program and website. All right, and finally, just a quick reference slide with some commonly used attestation acronyms. Most of these I think you'll recognize, some maybe not as much as others, such as I&A, or Identification and Authentication System, or EIN, Employer ID Number. Just so we're all on the same page here, since there truly are countless amounts of acronyms when it comes to quality reporting lately. So with all of that information in mind, let's begin walking through the attestation process. And to make things even easier on you, if you decide to use this slide deck while attesting, I've included screenshots taken from CMS on almost every slide, so you're able to view the attestation portal page by page. So we're all aware that to receive an incentive payment or just avoid a payment adjustment, Medicare EPs must attest every year to their meaningful use of certified EHR technology using the CMS attestation portal. This portal can be accessed by entering in the URL on that screen. Once the user navigates to the site, you will see this welcome page. This page provides an overview of the Medicare Meaningful Use site, as well as an overview of eligible professional and eligible hospital types. One thing to point out here is that EPs may not be hospital-based, and this is defined as EPs seeing 90% or more of their Medicare-covered services in a place of service 21 code or hospital inpatient setting, or place of service 23 emergency department setting. So if you are deemed a hospital-based provider, you will not be eligible to participate in the Medicare EHR Incentive Program for this reporting period. You want to make a note that your hospital-based status is actually checked yearly and may differ based on the reporting period in subsequent years. So something worth looking into. Once we continue on to the next page, you'll need to read the statements on the page and check the box to indicate that you acknowledge that you're aware of the statements, and then click Continue. This is an example. It's pretty self-explanatory here. Just keep in mind, I'm going through every single step or click you would see as a user. So some of these may seem extremely simple and a bit tedious, but I wanted to make sure we didn't skip over anything. Once you hit Continue, you'll be redirected to the registration and attestation login page. Here, If you're a provider, you would enter your National Plan and Provider Enumeration System web user account, or your NPPES login. Now, if you're working on behalf of an EP, you will need to have an Identity and Access Management System account and be associated to the EP's NPI. So just some helpful hints here for providers who may not have this information. If you're a provider and you have a login but you can't remember your password, you're going to want to contact the PICO's help desk. Or if for some reason you need to locate your NPI number, you would actually go to nppes.cms.hhs.gov to get that information. Now, I mentioned before, we're aware CMS allows eligible professionals to designate a third party to register and attest on his or her behalf. Again, to do so, users working on behalf of the EP must have an I&A web user account and be associated to that EP's NPI. If you're working on behalf of one or more EPs and don't have that I&A user account, you're going to want to visit the I&A security check to create one. And these screenshots show the login instructions for a user working on behalf of a provider and how to register for a new I&A account by selecting that Create Account Now button I have boxed out on the slide. You will then be directed to the user registration page, where you will need to enter the email address associated with your account, retype it to confirm, enter that security text, and then click Submit. Once you enter your email address, you will receive an email with a PIN number to verify your account. You'll want to come back in here, enter that PIN, and click Submit. So if you look at the steps to creating an account, it's pretty typical in what you would see when you create other online accounts, such as an online bank login. You're going to need to create a user ID and password for your account. Then choose security questions and answers in case you forget your password. After, you'll be asked to enter your personal information. And then just a heads up, you will be asked for your social security number, and that's just to verify your identity. And then click I agree. Next, your address is going to show up in that third screenshot. It might just need to be reformatted to meet USPS standards. That's all that yellow box is showing you in that third screenshot. And then finally, the last screenshot would only appear if for some reason your identity couldn't be verified. You would receive a notice with more information on it. Now, as long as you don't see that last screenshot that they're unable to verify your identity, once you've entered all that information, you should receive a confirmation email and see a screen notifying you that you've been successfully registered. I do want to point out something very important, which is participants cannot register and attest on the same date. Keep this in mind if you're planning on waiting to attest. You can't sit down on February 28th and go through the entire process. So I'm urging everyone on this call to start this process as early as possible. Now, once you've successfully logged into the I&A using your new account, you will see the main welcome page. Here you can update your profile, manage your connections, or just access some helpful resources. To finish registering through the I&A system, you will need to enter your personal information in the My Profile tab. And if you would like to add an employer or a provider, you can do so at the bottom of the page. So to add an employer, enter the organization information, including the NPI of the provider you want to be associated with, and then click Search. After you search, you will select your employer from the search results, or if for some reason your provider is not listed, click Add Employer Not in List. You will need to fill out the following form with the correct information, including your employer ID number, and then select Delegated Official as the role you're requesting for that provider. So once you've added your provider, verify the information in each of those grids is correct. I know it's blank right now. Normally you would see your provider information, just for the sake of an example. As a delegated official, you will need to have the authorized official confirm your request, which means the provider has to actually go in and confirm your request. When you review the information and confirm it's accurate, go ahead and click Done. At this point, you've successfully added your employer, and you will see the status of your request in your Profile tab. Now, to have a delegate request confirmed, your provider will need to log into the INDA system and review their Home tab. And they will see any pending requests to connect where they can click Approve or Reject. Now, when your provider approves a connection, they will see a confirmation screen, and they will need to click Submit. So before anyone asks, sadly, no, there's no getting around this step. If you would like to attest on behalf of your providers, they will need to know their NPPES login information and go in and approve the request. This can take time, and it can cause a lag in the process. So again, just another reason I suggest starting this process earlier rather than later, and letting your providers know that they have to do this step instead of rushing at the end of the month. Now, you as a delegate will be able to log in, and in the My Connections tab, you can view the details and status of each of your connections. So once your account is connected, the EP or organization you're working with, you're going to actually be able to begin the attestation process. So once you're approved, you can log in, and you'll see this welcome screen, which consists of 4 different tabs to navigate through the registration and attestation process: Home tab, Registration, Attestation, and Status. Now, the Home tab will alert you of your next step in the process, such as when your registration needs to be completed or that it's time to begin attestation. It also contains some instructions. The Registration tab will allow you to complete or modify registration. It will also allow you to switch incentive programs from Medicare to Medicaid or vice versa if you need to. It also allows you to cancel participation in the program. The Attestation tab will show you the status of each provider for which you're attesting and allow you to continue the attestation process. And then the Status tab will display your next step in the process, and it actually allows you to view your current registration, attestation, and payments for the incentive program. So if we click on the Attestation tab, we will see the Medicare attestation instructions, which explains the actions you can take. These actions are attest, so again, begin Medicare attestation, modify a previously started attestation, cancel or inactivate a Medicare attestation prior to receiving incentive payment, resubmit a failed or rejected attestation, reactivate a canceled attestation, and view or review the attestation summary after submitting. I want to point out only one of those actions can be performed at a time on this page, but you can filter by NPI to find the provider you're looking for, and then click on the action you wish to carry out. So you would click on Attest in the action column to continue the attestation process. Just a side note here, if you aren't seeing some of the options we covered in the previous slide, it's because Resubmit, Modify, Cancel, and Reactivate are the available action links for returning users only. Once we click Attest, we will see the 3 topics to complete for attestation, and those are attestation information, meaningful use objectives, and clinical quality measures. The topics will only be marked as completed once all the information has been entered and saved. When all the topics are actually checked completed, or if they show NA, the user can select Continue with Attestation that's currently grayed out on that screenshot right now. So from here, you would click on the topic Attestation Information to further the process. To start, the first piece of data you will need to enter is your CMS EHR certification number. You will also need to enter the start and end date of the reporting period you're attesting for. So keep in mind the EHR reporting period is a minimum of any continuous 90-day period between January 1st, 2016 and December 31st, 2016. You will want to make sure you match this date range exactly to what shows on your measure summary report. And then once you've entered that information, go ahead and click on Save and Continue. Now, just as a refresher, we included how to get your EHR certification number. So you would go on the website and search for the comprehensive list of certified health information technology for NextGen or whatever software vendor you're using. You want to make sure you know what version or versions you use during the reporting period, and that you add any other third-party products to your cart as well. If you're using a third-party product for patient portal, anything like that, you want to make sure you add that to your cart as well. After you select your EHR and third-party products, you're going to click View Progress, and then you'll click Get Certification ID, which you will then want to email to yourself for your own records. And then just so you know what you're looking for, the CMS EHR cert number is 15 characters long, and the alphanumeric number is case sensitive. And it's absolutely required to proceed with attestation. So you're going to want to email it to yourself, write it down, whatever you need to keep track of it. So you can follow these instructions that we gave you. If you're still having trouble when you're actually on the attestation portal, there's a link right there on the page that says, how do I find my EHR certification number, which will also provide you with instructions as well. So once you enter the EHR cert number and your reporting period dates, the attestation information topic will show completed, and you will move on to the meaningful use objectives topic. Before we start, I want to point out some of these screenshots have not been updated to reflect the 2016 changes, and if this is the case, I made a special note highlighting the changes for your benefit. So this is the first page you would see once you move on to meaningful use objectives. It's basically just a summary of all the required objectives for Modified Stage 2. You'll notice on this page you have to choose 2 of the 3 public health measure options by checking which ones you plan to attest to. So EPs scheduled to be in Stage 2 must attest to at least 2 measures. You can claim an alternative exclusion for syndromic surveillance or specialized registry reporting. So for an EP that plans on claiming an exclusion or an alternate exclusion on any of these public health reporting measures, you must select those measure options on the screen. So you can either attest to them or attest the exclusion or alternate exclusion. Keep in mind, CMS did finalize that an exclusion for a measure does not count towards the total of the 2 measures. Therefore, the EP must claim the applicable exclusions or attest to the remaining measure in order to meet the objective. So, for example, let's say you're planning on claiming an exclusion for syndromic surveillance. You would check 3 boxes. Syndromic surveillance, so you can document the exclusion, and then the 2 other you plan on attesting yes to meeting the measure. So in this example, or in this screenshot, we're going to attest yes to immunization registry and specialized registry reporting. After selecting your public health reporting options, you will start the process of actually going through each objective and its measures. The user should read the objective and measure and then respond as appropriate. So you would select yes or no to conducting a comprehensive security risk analysis that was updated annually, and then click on Save and Continue. This is really no different from previous reporting years, and you will want to make sure you keep a copy of your security risk analysis in your audit binder, since these are extremely important to the HHS, to CMS, even OCR, when they're conducting meaningful use and HIPAA audits. Objective 2, clinical decision support. This objective has 2 parts. There are 2 measures. First is implementing 5 clinical decision support interventions, which you will need to answer yes or no to. And then the second part, enabling drug-to-drug and drug-to-allergy interaction checks. The first thing you should do is answer yes or no to the exclusion. And if the exclusion of writing fewer than 100 medications does not apply to you, answer yes or no to the measure. Yes, no attestations do usually require screenshots from your EHR to include in your audit binder. We recommend that a screenshot of the clinical decision support interventions, drug-to-drug, and drug-to-allergy interaction check settings actually be placed in your audit folder. These documents should be retained for a minimum of 6 years after your attestation, just because your audit binder will provide that necessary verification if you're selected for an audit. Objective 3, computerized physician order entry. This objective has 3 parts: medication, labs, and radiology orders. For these, you will need to select the appropriate option under patient records. You also need to answer yes or no to the exclusion, which is if the EP wrote less than 100 medication orders. If you click no to the exclusion, the screen will expand, and then there you must enter the numerator and denominator for the measure. The numerator and denominator will only contain data that was done during the reporting period. Anything done outside of the reporting period doesn't change the numerator or denominator. Part 2, or CPOE labs, it's the same format. You have your exclusion, patient records designation, and then the numerator denominator data if the exclusion doesn't apply. I do want to point out that EP scheduled to be in stage 1 in 2016 may claim an alternate exclusion for objective 3, measures 2 and 3, lab and radiology orders, or they can choose the modified stage 2 objective and measure. It's up to them. And then lastly, part 3 of this objective is radiology orders, following the same steps to input information. I know I covered the alternate exclusion available for this measure as well in the last slide, but you may be asking, how do I know if I qualify for one? Well, the Medicare and Medicaid EHR Incentive Program system will actually automatically identify providers who are eligible for alternate exclusions. So upon attestation, these providers will be offered the option to attest to the objective and the option to attest the alternate exclusion if applicable. So again, no need to worry here. If it applies to you, CMS will automatically know. Moving on to objective 4, e-prescribing. The user is attesting to generating and transmitting prescriptions electronically. There's no change from previous reporting periods. You will need to look at both of the exclusions and decide if either of them apply. If they don't, you will need to enter the data. Fun fact, CMS did go out of their way to specify that numerators and denominators must be whole numbers. I'm not sure why they wouldn't be, but just in case you were wondering, now we know. A few other reminders for next-gen users. Numbers come from the Meaningful Use 2 Objective Summary Report in the HQM. And you want to make sure you check that the reporting period on that report is correct and matches the one you inputted in the beginning. Next, Objective 5, Health Information Exchange. Again, no major changes here. We're seeing the same format for entering data. Most of you on the call are meeting this measure using NextGen Share to electronically send CCDAs. Just a helpful hint here for NextGen users is that in order to exclude referral orders to providers within the same practice or enterprise from your denominator, the internal referral checkbox must be selected when the order is placed. Objective 6, patient education. The provider must use clinically relevant information from the EHR to identify patient-specific education resources to give to the patient. We do have an exclusion for providers who may have had no office visits during the reporting period. Otherwise, you will need to input the data from your summary report. We are aware patient education is an integrated feature that provides easy access to patient instructions related to clinical encounters and diagnosis. You can access patient education from various points in NextGen, which include HealthWise, the Health Promotion Plan, and Medline Plus. Objective 7, medication reconciliation. Medication reconciliation is actually a formal process of obtaining and verifying a patient's current medicines following a transfer of care to your office. Again, we aren't seeing any big changes here in regards to the measure threshold of 50%. If the exclusion does not apply to you, then you will enter the numerator and denominator data. I know I didn't point this out earlier, but if you look at that screenshot, CMS does a really nice job of explaining this information to the user by breaking down what is exactly counted in the numerator and what is exactly counted in the denominator as well. Objective 8, patient electronic access. This objective has 2 measures. For an EP to successfully attest, they need to invite more than 50% of patients to the patient portal. Patients who are given a token and register can view their problems, lab results, vital signs. They can also manage their accounts and message their providers. So this objective is often referred to as the patient portal objective, and it has those two parts. So part one, or just meeting the first measure, the provider just must issue the token. And a token code can be provided even if the patient doesn't provide an email address or doesn't have an email address. You're still going to get credit for that. Part two is actually having one patient view, download, or transmit their health information. So to make this a little easier, in NextGen it's recommended that PHR be enabled, and token codes are provided to all patients prior to or up to 4 business days after their first encounter during the reporting period. Basically, turning on PHR in the NG patient portal allows patients to access their health information without staff involvement. Moving on to Objective 9, secure messaging. This is one instance where the screenshot's out of date. Last year, providers just had to have the capability to send the message enabled, whereas now the measure actually states for at least one patient seen by the EP during the reporting period, a secure message was sent using the electronic messaging function of CERT to the patient or in response to a secure message sent by the patient during the reporting period. Essentially, a provider just needs to send one message through the portal to a patient during the reporting period. Finally, the last objective, public health reporting. So first off, remember when we selected the measures we would report on before we started? Well, if you did not select this public health measure option at the beginning, you won't see this screen. You will only see the screen for the public health options you choose. So we know all providers in 2016 must engage in 2 public health options, unless for some reason through exclusions the provider has less than 2 options available to them. So depending on why this measure is showing up for you, you will either answer yes or no to the exclusion. And if the exclusion does not apply to you, you would answer yes or no to the measure. The same format goes for syndromic surveillance. However, I mentioned earlier that CMS will recognize if you are eligible for an alternate exclusion. It'll automatically appear. Well, here's an example of this. So again, providers scheduled to be in Stage 1 and Stage 2 in 2016 may claim an alternate exclusion that might require acquisition of additional technologies that they didn't previously intend or include in their activities for meaningful use. So EPs may claim an alternate exclusion for Measure 2, syndromic surveillance, and Measure 3, specialized registry reporting. So you'll want to answer yes or no to the alternate exclusion, then the exclusion, and then the measure if it applies. Please note for all of the measures and the exclusions or alternate exclusions, if they don't apply, you should be clicking yes in order to pass meaningful use. If you click on no, that means you failed an objective. Now, this doesn't mean go through and click yes no matter what. This information needs to not only be true, but also supported by an audit binder in case of an audit. And lastly, specialized registry reporting. Keep in mind, EPs may report to more than one specialized registry and can count it more than once. And then just another helpful hint from us, we recommend that any documentation that's received as part of your communication or verification of registry participation is placed in your audit binder. So this could be anything from emails with the registry, or we've seen even a screenshot of a website stating a registry is not available or it's not ready. Bottom line, any documentation you have to support the data you entered throughout the attestation process, you will want to keep. All right, so we made it through 2 of the 3 topics needed to complete the attestation process. The last one is clinical quality measures, or CQMs. Now, some of you may not be reporting your CQMs through the Meaningful Use portal, and you might be reporting them aligned with your PQRS data, and that works. But we wanted to make sure we briefly cover this for those of you that are using the portal. And I will go ahead and pass it off to Cindy for this section. So Cindy, it's all yours.
All right, thank you, Lindsay. First of all, I want to say that Lindsay needed a break from all of this really exciting information that we're sharing with everyone, and that's really the only reason I'm taking over here, because she fully did all of the work associated with this webinar today, so I want to thank her for that right off the top. So as we move on to clinical quality measures and just talk about how you're going to be going with that, let's take a little bit of a refresher on what they are. Clinical quality merit measures, or CQMs, are tools that help measure and track the quality of healthcare services provided by eligible professionals, hospitals, and critical access hospitals within our healthcare system. These measures use the data associated with providers' ability to deliver high-quality care or relate to long-term goals for quality health care. CQM measures many aspects of patient care. And I'm sure we all have a debate as to whether or not some of the templates and the things that are used to track this are perhaps the way every provider would do it, but these are the measures that are in place to actually help you qualify for meaningful use. In order to participate in the Medicare and Medicaid electronic health record incentive programs and receive an incentive payment, providers are required to submit CQM data from certified EHR technology. So let's talk a little bit about reporting CQMs as you're doing your attestation for meaningful use. On the Clinical Quality Measure homepage, the user must select between two options before moving forward. If you select with option 1, you must electronically report using Medicare EHR Incentive e-reporting option, or you can submit CQM data using the Comprehensive Primary Care or the CPC Attestation module. If you choose option 2, you may enter the CQMs manually to complete your attestation. So let's take a look at the sample screen. After you choose option 2, you're going to be taken to the page, and we have a sample of this page on the slide that you're looking at, and it will give you the instructions for selecting your CQMs. You are required to select a minimum of 9 clinical quality measures from the list. Your selection must include at least 3 of the 6 HHS National Quality Strategy domains. And when you make these selections, you want to make sure that whatever you're selecting and how you're doing it, that you have the documentation in your binder to support the quality measures that you are selecting and choosing. Then it'll move on to the CQM questionnaire. So once you've made all your selections, you're going to be prompted to enter the numerator and the denominator, performance rates, and exclusions, if applicable, for a selected clinical quality measures. You want to do this for all 9 measures that you have selected. And for next-gen users, this data can be found in your CQM summary report from the HQM. As a helpful hint, make sure you confirm the correct measure, version, and title and description before submitting. In other words, pick the correct one. Check it and double-check it. Now moving on to submission. So once we've got through all of the processes that Lindsay described and we've selected our CQMs, if you're not in line with your PQRS, we will now move on to the submission process. And this process is a time-consuming process, and we're just going to take you through it step by step. As Lindsay mentioned, we have all of the screenshots, and we're taking you through it so that you will be able to use this slide deck as a model as you're going through. So when all your topics are marked as completed or not applicable, you may proceed with attestation. You will be able to view your entries before the final submission, just like when you're voting. So once it's all done, you're going to click Continue to move forward with the attestation and complete the attestation process. These are the statements that you'll be looking at as you're going through. So this is the submission process attestation statements. You're going to check each box next to each statement to attest. And notice these statements have been expanded to address information blocking. That is an area that has been changed and added, and for those of you who understand information blocking, this is basically stating that you are willing and able to share your data and go with the portability of healthcare data that is moving forward. So if there's any questions on information blocking, we can talk about that, and we've actually done some webinars on that in the past. To complete your attestation, you must click Agree. Select Disagree button to go back to the home page, and if that's the case, if there's something you need to change or you don't agree with this statement, then you can move back to the home page and your attestation will not be submitted. There is a disclaimer that you are going to have to acknowledge, and so first you want to read the disclaimer and click on Agree or Disagree. If Agree is chosen and you've met all meaningful use objectives and measures, you will see the Accepted Attestation page. CMS recommends you review all of your attestation before submitting, because once you submit and it's accepted, you will not be able to make changes. At this point, you will receive the accepted attestation screen, and you'll see that it passed attestation. We're going to tell you a little something as we're moving to break up the results. We had a big debate on how to say attestation or attestation before we started, and now I'm kind of blending the two, so I'm just mucking this word up all together today. So we'll move on with accepted attestation. If your submission is accepted, you will see the accepted attestation submission receipt, which contains attestation tracking information. This concludes the full process, and you will have this, and you can basically click on your review results to review the summary and details of the objectives, measures, and clinical quality measures. Please print this receipt, and you will also receive a confirmation email. But let's assume that perhaps it was rejected. You made a mistake, something didn't go right, you thought everything was okay, but there was something that happened. You might see the message that pops up here that the EP did not demonstrate meaningful use of certified EHR technology because one or more objectives were not met as indicated by non-compliant measures. One or more meaningful use objective measures calculations did not meet meaningful use minimum standards. This is the message you would receive, and if it was rejected, you will get this message. This means that you didn't meet one of the measures. Likely a mistake because obviously you probably wouldn't be attesting if you thought you weren't going to meet it. However, you will need to reassess or modify your data so that you can meet the measure to move forward. At this point, the review summary, once you click this, you can review your documentation to ensure the correct information was entered as attestation for each of the objectives and their associated measures. If an error is found or you find the error that you made, you may make the correction and resubmit your attestation for the same reporting period. So basically, you're just going to go through, take a look, be able to review it, correct it, and then you will basically go ahead and review forward. At this point, you'll be directed to resubmit under the action column. And when you click on a measure list, you will navigate to the first page of the chosen measure, click Save and Continue until you get to the appropriate measure for editing. Once you've gotten to that area and you make your changes and you know what you want to do, you will then click Save and Continue through the remaining measures to the topics for the attestation page. Once you've done that, all of the topics will show complete. You can now resubmit. And at this point, you'll see a status, and when you receive this status, you will also then finally, just as we did before, when you've finished your attestation and received the accepted attestation receipt, click on the Status tab to see your progress. So you can then click on the appropriate tab to see your registration, attestation, and payment status. I'm going to hand it back over to Lindsay now that she has been able to rest, and I will let her take you through the rest of the options until we close out the webinar.
Great. Thank you, Cindy. Yes, it was a much-needed break. I'm sure you all wanted a break from constantly hearing my voice as well. Change things up a bit here. So just some quick attestation recommendations from our team. We've helped countless clients with the attestation process, so we put some here together for you, just a Cliff Notes version. So let me start out with our #1 best practice to ensure a smooth attestation is getting organized and being prepared. This means collecting all the documentation you will use to submit your meaningful use data. We suggest you export all documents used for attestation. Specifically, print your meaningful use summary report and your CQM summary report from the HQM. We also suggest you have in a folder, either in paper or on your computer, as long as it's backed up, that contains documentation that verifies any actions completed outside of the EHR, such as screenshots or your security risk analysis. Also, you're going to want to keep any documentation to support any applicable exclusions, such as screenshots. Think of your public health reporting. You'll want a screenshot of those registries not accepting data yet, or your summary report. Let's say you fell under one of those exclusions where you wrote under 100 prescriptions. That'll come from your summary report data form. So I understand you don't need these screenshots to attest like you do your summary report that actually has the numerator and denominator data to input, but this ensures you're accurately attesting in case of an audit. You know you have 5 clinical decision support interventions enabled because you're looking at the screenshots that prove it versus assuming you had that done. Our other big recommendation is to just be aware of the attestation resources available to you. it doesn't matter if it's your first time attesting or if you've attested 30 providers before. The system changes, and you're bound to have at least one question throughout the process. So be aware of where you can find the answers without delay. So we're providing you with the slide deck and the recording. CMS has attestation guides and worksheets as well as a help desk. And then NextGen also has meaningful use white papers that may help as well. Another best practice is to utilize the attestation worksheet CMS has made available, which is essentially a paper copy of exactly what you will see in the attestation portal. So we suggest you fill this out prior to attesting, and then you have it next to you while you're attesting. You can see kind of with the screenshot the similarities here. It asks you for that exclusion first, and then it has you put in the numerator-denominator data. Also, we mentioned this report earlier, but you will definitely want this printed or exported for while you're attesting, and then you'll want to keep this for 6 years after attestation in your audit binder. This is the report your numerator and denominator data will come from. And then again, just a last reminder, up at the top, you're going to want to make sure you check the reporting date range. And if you're reporting at the last quarter of this year for that 90 days, it's going to be 10/3 to 12/31.
Okay, so if you're uncertain where your practice stands, ITenace can help you, not only with the webinars that we're attending today and helping you get through meaningful use, we can assess your current readiness. We can provide recommendations, and we can assist in implementation of new processes and procedures. And now we're introducing 3 new MACRA packages. It's a tiered fixed price MACRA support. We've been receiving a lot of questions and information requests from other individuals about how are we going to handle MACRA, what do we need to do. So we've come up with 3 packages that we'll be happy to provide information on for anyone who would be interested after this webinar. We have a MACRA Fundamentals, a MACRA Intermediate package, and then the MACRA Expert package where we can help at all levels. And finally, our next steps. Visit us at itenace.com. Sign up for our informative webinars and blogs. Consider our 3-day fixed-price on-site consultations, clinical workflows, revenue cycle and front office, technology and performance reviews, and then test drive our products. And over the next few months, we're going to be adding more and more fixed-price opportunities to be able to assist with things that we're covering in our webinars. So for now, let's move on to questions, and we'll open up.
Wow. That was so much information. Thank you both for presenting that. Lindsay, thank you for putting it together. I know that that was a lot of information to digest at one time. So just as a reminder, we will be sending out an email with a link to the recording and copies of the slides as well. So you can review these at any time that you want. And you see Lindsay's and Cindy's information up on the screen. You can always reach out to them with questions directly, or you can reply back to any of my emails that I send with the invitations and follow-up emails and all of that. And really, any way you get information or questions to us, we'd be happy to help you with them. So feel free to reach out to us. Questions that we're going to take now, you can type in the GoToWebinar control panel in the questions area, and we're just going to take them in the order that they're received. So first question, regarding delegate request. If they approve the request, does this extend approval over to next year as well?
I can grab that one, Chelsea. Because it's through your account, which is verified with your social, and then through your provider's NPI. Again, as long as those accounts remain active, it should roll over year after year. I would just suggest logging in now, ensuring that you do still see that connection is available. If it's not, you'll have to go through that process again. But I think the main point here is yes, but I would log in, double check just to catch it early if it didn't for some reason. Just because, again, I wanted to reiterate, you can't register and attest on the same day.
Great, thank you, Lindsay. Next question. We are part of an ACO and are an APM, not MIPS. The ACO does our quality measures through GPRO, but we are responsible for ACI. How does this work with NextGen?
So I can grab that one. So sorry, I don't have the question in front of me. Just to kind of restate, you guys are going to be reporting under the APM track, not MIPS. You won't be taking care of your quality measures, but you will be responsible for the ACI category. So how this is going to work is, again, for everyone online, this is clarification. This will be for 2017 reporting under MACRA, a little bit different than what we were covering here, but you're going to be responsible for those ACI measures and reporting them. The HQM, the 2017 upgrade, hasn't been out yet. They're doing a webinar next week on it. They haven't loaded the new programs yet, so the tracking may be a little bit different, but you're going to be responsible for running those reports in your HQM, making sure that you're meeting these measures. There's only 4 that are actually required to be met when you're actually reporting under MIPS or doing the ACI category by itself, and then the rest are just used to improve your performance score. So we haven't heard exact specifics on how NextGen will actually cater to these specific needs. We, I think, need to look out. It sounds like a very specific situation you're in with the ACO and APM with NextGen. We can look into it, but I would suggest reaching out to NextGen.
Great, thank you, Lindsay. Next question. Do you know if the EHR reporting period will remain as 90 days for 2017?
I can grab that one as well. Yes, it is going to be 90 days for 2017, as well as they announced for 2018, I believe, too. They're doing this as a transition year, but you also want to keep in mind for 2017 under MACRA, you have a new pick your pace option. So with this option, you actually can just choose to test your system and send one data point, one quality measure for one patient. But I would suggest, again, you have the option to report for a whole year, or you do have the option to report for 90 days. So that is available for you.
Great, thank you, Lindsay. Next question. Can you be an authorized delegate for more than one provider?
I can grab that one. Yes, absolutely, and most people are. Unfortunately, as we showed in the webinar, you will have to go through the process we did earlier for each provider you wish to attest for. There is no way to do them all in a batch, and it is on an individual basis, so it's quite time-consuming, and you'll want to make sure you allow for that. And yes, each provider will need to know their NIPS username and password in order to sign in and approve the delegate request. I can see the questions. I know, Lindsay, you cannot, so I do want to follow up on the one about the following up with NextGen. If you are a direct client, not everyone on this call is a direct client of ours, but if you are a direct client, we will reach out to NextGen at the appropriate time. They haven't released all the information that we need to answer these questions for you about the ACO and the GPRO, but we will be able to track that down, and we will know it when they have actually put all the information out and make it available to us.
Thanks for that clarification, Cindy. Okay, so it looks like this may be our last question, but again, we'll keep hanging on just in case people are still typing questions, and as always, reach out to us, anybody that you see up on the screen or even through social media. So last question, what is this patient record designation refer to that I'm not familiar with this?
I can grab that one, Chelsea, too. So I've gotten a lot of questions about this actually going through the attestation process. So basically what this means is at the EP's discretion, the numerators and denominators of certain measures can actually be calculated using only patient records maintained in your certified EHR technology. But the provider can also choose to calculate numerators and denominators of measures for all patient records. Let's say if you do have some still on paper. EPs must just basically indicate which method they use in their calculations. Basically, it's just saying whether the data used to support the measure was extracted from all patient records or only from records maintained in the EHR. Just kind of the clarification you need to understand.
Great, thank you for that, Lindsay. How do I get a copy of today's slides? So we'll be sending out an email to everybody who registered for the webinar with a link to the recording, as well as on that page a button that you press to download a PDF of the slides. So we'll send that out as soon as we get it up on the website. Usually it's within a week. And you can always find any of our past webinar slides and recordings on the Events and Education page on our website as well. Another question. Should we be concerned if the numerator in the CQM for a provider is 0?
I can grab this one too, Chelsea. No, as long as you're submitting your CQMs through the Meaningful Use Attestation portal, or you're doing it manually, having a 0 in the numerator or even a 0/0 data is actually accepted when submitting meaningful use. You can't have a 0 for PQRS measures, or if you're actually submitting data aligned, then you couldn't have a 0/0. But as long as you're submitting it through the meaningful use portal, this should be okay and it shouldn't affect you at all.
Perfect. Well, it looks like that's all the questions that we have. So thank you, everybody, for joining us today. I hope you have a wonderful rest of the day and a great week. And keep your eyes out for that follow-up email from me with a link to the slides and the recording as well. Cindy, Lindsay, thank you both so much for your time and for presenting today.
All right. Thank you, everybody, for joining us, and have a great day.
Thank you.